On the 20th of March every year, we ask the world to unite to help reduce the burden of oral diseases, which affect individuals, health systems, and economies everywhere. Now, what is the purpose of World Oral Health Day? Well, World Oral Health Day aims to empower people with the knowledge, tools, and confidence to secure good oral health. Now, why is the World Oral Health Day important? Oral diseases are a major health concern for many countries and negatively impact people throughout their lives. Oral diseases lead to pain and discomfort, social isolation, and loss of self-confidence. And they are often linked to other serious health issues. And yet there's no reason to suffer. Most oral health conditions are largely preventable and can be treated in their early stages. So today I'm going to be talking to Dr. Nathan Vermaak, who is no stranger to Clicks Live. I've chatted to him before. A happy mouth is a happy body, a crash course in oral health. Now, Nathan is a general dentist with a special interest in implantology as well as digital and cosmetic dentistry. For the past 6 years, his passion for dentistry and particularly dental technology has driven him to spend countless hours developing these skills to make treatments more predictable and efficient. He's currently in private practice based in Melrose Arch and Rosebank, utilizing his craft to improve oral health as well as mentor young dentists who practice in the surrounding neighborhoods. Wow, what a busy guy, man. Dr. Nathan Vermaak, welcome, sir. How are you, man?
Thanks for having me. No, I'm great. Yourself?
Good, thank you. It's good to talk to you again. So, of course, you are based in Melrose Arch and Rosebank, so people are able to come and make an appointment to come and see you if they are that side of the world?
Yes, definitely.
All right. Okay, so Dr. Vermaak, we are talking about a happy mouth is a happy body, a crash course in oral health. What are the benefits of good oral health for your overall well-being?
Yeah, that's a good question that I often bring up with most of my patients. Often because we're seen as in isolation as, I've got a tooth problem, instead of, looking at our body as a whole. And often our mouth is a starting point to a lot of our nutrition, nutrients, supplements, vitamins, and medications. And, having a good oral health is not only important for your teeth and gums, but in your general health and your quality of life. So poor oral health can also increase your risk of systemic infections, chronic diseases, and some complications such as heart disease, diabetes, stroke, and even to the extent of having a preterm birth.
Wow.
So good oral health can also boost your self-esteem, confidence, and social interactions, and, which also has an overall well-being factor to it.
So what is the role of flossing and mouthwash in maintaining good oral hygiene? Is it important, Dr. Vermaak?
So when we often see a lot of the patients, it's when there's already a problem. And so one of the main things is prevention is a lot better than cure. And one of the things you can do on a day-to-day basis from home is flossing and using mouthwash in conjunction with your normal brushing to be able to get you maybe from that 60% clean as close to 100%, so that you can be maintaining your teeth, your gums, as well as your whole oral cavity to prevent things like demineralization, wear due to acid buildup, decay happening in between teeth for not flossing. So these are, by having both mouthwash and floss added to your regimen, you can have a much better prevention of cavities, fight off gingivitis, and even, have fresher breath.
So what are some of the signs and symptoms of oral health problems that you should not ignore, Dr. Vermaak?
Most people think that the first sign of anything bad is pain. Sometimes there's some warnings before that. So a lot of the times, bleeding gums might not necessarily be painful. Swollen gums, your gums dropping, which the technical term is recession of the gums, sensitivity, any difficulty chewing, swallowing, or speaking, loose or broken teeth. They don't always have to be painful, but if they're present, they can harbor bacteria and, therefore put your body under more stress and strain than it needs to be. Changes in color, shape, different textures in your mouth, sores, lumps, unexplained weight loss can even be a sign that there is something underlying oral health disease.
Wow.
If you have any of those kinds of signs and symptoms, it would be better just to consult with your dentist as soon as possible. Often, we do even hear stories of patients that went to a general GP a couple of times before seeking their dentist for even a mouth sore. When it's something that could have been prevented in a first stop, you've been to one or two practitioners now, and then the symptoms may still be there.
Wow, that's very interesting to know, sure. Clicks Live, Stephen Taylor with you. We're talking to Dr. Nathan Vermaak. Dr. Vermaak, how can you improve your oral health through your diet and lifestyle choices? Is that a thing? I didn't know.
Yeah, like I said in the beginning of this talk.
Yeah.
A lot of what we take for granted is our mouth is how we put any nutrients into our body.
Yes.
It's also how we essentially overconsume. We live in a lifestyle where we overconsume in calories. We don't necessarily eat a balanced diet. And, it's not only the amount of calories we take in, it's our choice of what we eat. So a lot of foods have a high acidity compounds in them, such as sodas, for example, creates more acidic environment in the mouth. Sugars are the worst enemy for dentists,
yes.
Mainly because sugar is a fuel for the bacteria to then cause decay in the mouth. And along with that, having a balanced diet, such as fruits, vegetables, whole grains, lean proteins, and some dairy products, you're getting vitamins and minerals that you need, as well as antioxidants, and there's other nutrients, micro and macronutrients, that all support your oral health, as well as your immune system and your general health. So if you limit the bad stuff, I'm not saying it's very difficult to prevent it at all, but if you try and limit it, you can kind of have a more predictable outcome in terms of your oral health, and
yes.
as well as your general energy levels throughout the day, as well as how well you sleep at night, as well as how, you get that midday slump. It could be from too much carbohydrates in the middle of the day.
Sure.
So, there's plenty of, like this question alone, we can probably talk for a couple of hours. And it goes as far as to say, I see a lot of people these days drink sports drinks. And
yes.
not only the sports drinks, but like caffeinated energy drinks.
Yes.
And often I would imagine it's because of the taste, and it's a lot more affordable than your premium brand sodas. And those have quite a high acidic value to them. So not only does it have direct erosive effects on the teeth, but also remember, our gut health depends on what we eat as well. And your gut health can also depend on how you metabolize food, how you utilize minerals and vitamins. So we have to kind of start thinking broader and a little bit more mindful of what we put in our bodies. Alcohol is one of those things that can also change your acidity levels, your gut flora, as well as tobacco. And, there's many of these things. And it's not only lifestyle in terms of what we can eat, but lifestyle in terms of stress levels.
Mm.
The higher your stress levels, the higher your chance of having something go wrong in terms of inflammation, immune overregulation in the body. So,
wow.
Not only when I'm talking stress, I'm talking career,
yeah.
family. I'm not only talking about that. I'm talking about, if you're having 10 packets of sweets a day, and that's in a very excessive example.
Yes.
You put in your body under a whole bunch of stress. And it's not necessarily the stress that first comes to mind when we say, I'm feeling stressed today.
Yeah. Yeah, no, sure. There's different things in terms of diet and lifestyle. I mean, we live a fast-paced life. Sometimes we get home, we get some fast food, and that's probably not always the best life choices, but it's the quickest. So kind of changing your lifestyle and the way you do things sometimes might have very good benefits. So I agree with you.
Definitely.
Dr. Vermaak, how can you protect your oral health during pregnancy, menopause, or other hormonal changes?
So this is a very, very, very hot topic,
yes.
especially in our practices, because, there's a lot of patients that come, or moms to be coming in their second or third trimester with actual problems. So let's start off by talking a bit about pregnancy. So first of all, if you're planning on falling pregnant or planning on trying to have a child in the near future, my suggestion would be to go have a full dental checkup. No, because something that's small, if left for 9+ months, can turn into something quite large. As well as, during pregnancy, there's so much changes happening in your body from a hormonal to you're not sleeping, you've got the weight gain, you've got the hot flushes. There's so much happening. The last thing you want to do is have something like an old infection flare up because it wasn't checked beforehand, when it could have been completely prevented. With pregnancy specifically, I recommend, even during pregnancy, as long as you can be in the chair, lying flat on your back is not the most comfortable. As long as you are able to do so, to go for your cleanings every 4 to 6 months, just to make sure that the pregnancy hormones don't flare any gingivitis. And with menopause, there's often a flare of hormones that then dissipates, which can also lead to lots of mainly gum problems, as well as your absorption and reutilization of calcium deplenishes after menopause, which means that your teeth will be less likely to repair minor damages. And just for general hormonal changes, it occurs mainly about puberty time for both males and females. There's a lot of changes that happen. Your hormones come in, and your body doesn't know always how to react 100% to them, and we often see young teens with highly inflamed gums that sometimes do get ignored, and then it does lead to bigger problems later on, from mouth sores to tooth sensitivity to burning sensation in the gums, bleeding gums. So it's ideal to seek treatment at those times before it gets out of hand.
Okay, Dr. Vermaak, how important is pregnancy supplements and kind of supplements in general in terms of helping your mouth? Does it play a role? Does it help at all?
So in terms of pregnancy specifically, your body is utilizing a lot of your calcium stores, your vitamin D, your vitamin C, collagen. It's using a lot of those stores to essentially build a human. So you're creating life.
Yes.
So it has to get it from somewhere. So if you aren't getting adequate volumes through supplementation or diet, it will try and take it from the host, which is the mother. So it is vital. Largely calcium, vitamin D, and vitamin C. A lot of the supplementation that you can find on the pregnancy shelves in Clicks, for example, has adequate amounts of each of these minerals and calcium and compounds to allow you to then preserve not only your oral health, but your general health as well.
Okay, Doctor. Dr. Nathan Vermaak, any closing thoughts from yourself?
No, it's Oral Health Month. It's always a very dear part to us as dentists. Often, it's not anyone's favorite place to be is coming to the dentist.
Yeah.
So what we always try and do is specifically in this month, because we do a lot of outreach to schools, a lot more talks on radio stations and through social medias, is, try and be preventative. At the end of the day, we're living longer, and one of the biggest determining factors in older age on our outcomes in life is how much nutrients we can take in. Yeah. So if we're able to look after our teeth from a young age and therefore preserve them for as long as possible, we should have a better outcome in life, not only from a systemic disease point of view, because look, there's genetic factors, there's a whole host of other factors, but just in general, if you're otherwise healthy and you're able to take in nutrients, you'll have a better, longer, healthier life.
I like that. And what advice would you give me to try and help persuade my 5-year-old to come and see a dentist?
The best thing is, utilize what you have at hand. There's Peppa Pig books, for example. There's YouTube videos.
Yes.
Almost do reverse psychology. Make it their idea.
Okay.
My suggestion to any parent as well is try and get your child to the dentist before there's a problem.
Okay.
It's a very strange environment. There's bright lights. There's instruments.
Yes.
There's a strange man or woman with gloves and masks.
Yes.
It's all these aspects that make the whole experience a little bit more, kids are wary. They already anticipating pain, or they're anticipating something very different. So often when there's a kiddie that comes through and it's their first experience and there's no pain, we barely even look at the teeth. We play around with the instruments. We sit on the chair. We get used to the environment.
Yeah.
Because it's intimidating for adults, never mind for children.
Yes. It is. Okay, now thank you, Doctor. I appreciate that, man, and thank you for your time. As always, it's always a pleasure to talk to you, Dr. Nathan Vermaak, based out in Melrose Arch and Rosebank. Thank you for what you are doing. We do appreciate that, and keep up the good work, sir. Thank you very much.
Thank you for the platform.
Have a great day further. Keep well.
You too.
Thanks. Bye-bye. There we go. That's Dr. Nathan Vermaak having a chat to us. And this oral health interview is proudly brought to you by SADA. SADA's vision is to be recognized as the trusted leader and voice of oral health care in South Africa, or Southern Africa. Their mission is to promote the interests and serve the needs of their members, and above all, encourage optimal oral health care for all South Africans. And learn more about the South African Dental Association by visiting www.sada.co.za. Also be sure to check out more about the Young Dentists Council. All the speakers during this week's oral health awareness interviews are part of the Young Dentists Council Exco. Learn more about the Young Dentists Council by visiting www.sada.co.za/young-dentists-council YDC. Thank you to SADA for setting that up, and of course all about World Oral Health Day 2024. Be proud of your mouth. Official World Oral Health Day is tomorrow, but of course it is throughout the whole month, World Oral Health Month, as Dr. Vermaak said.